I started in Skid Row in 1993. I was actually working for an organization called Watts Health Foundation. At that time, the Los Angeles Mission was working with Watts Health Foundation, and they were providing medical outreach services via a mobile unit that used to park outside the LA Mission and provide health care for the homeless on the street, as well as some of those individuals who were in the program. And that's where I actually met Ann Calvo.
My primary objective for actually working at the mission was I felt God had called me to work there, but specifically to work with people with AIDS. Now remember, this was the early 90s, and a lot of people were getting infected, and sadly a lot of people were dying.
Ann would see the patients and get them going outside, and then we'd bring them into the room, and I was able to take care of them. In the room, we had a little supply of medications that we had there, but from very, humble beginnings, God actually used that, and I think the leadership at the mission saw that God was stirring people, and then they began to talk about bigger things and what could happen, and that's where they actually began to look for a place where we might be able to do more medical services.
It was in November, it must have been probably in 93, we brought all the men and women out, and every morning we would walk around the mission and we would pray. So we often would stop by the gate across from the Joshua House. And of course at that time it was a really bad motel, and we would pray for that building. Eventually the owner of the building approached Reverend Holsinger, the CEO of the mission, and begged him to buy it.
But we knew that was a very big task, and we couldn't do it alone. You had to partnership with people, and I think that's where the relationship with Cedars and Watts Health Foundation and Dr. Kim and just a group of people that God brought together was so foundational.
One evening, that was I think 1992-93, right after our church service at 6 o'clock, someone attacked me and put a knife on my throat here. But at the moment, I was a little bit frightened, but suddenly I felt kind of a peace in the heart. So, what happened to me? Why he's here? Probably some special reasons from God. So I feel kind of compassionate for him. So that time lots of street people, they're homeless people. What can I do for them to help them as a dentist? At that time we formed the Korean Dental Christian Mission. So everything is volunteers. Even laboratory fee, everything is paid by the dentist.
We made it, and we've always tried in the past to make it accessible as possible. We know that the homeless, those individuals in Skid Row, there's a lot of things going on in their lives, and we always tried to make it very convenient for them. I think we started that from the very beginning.
I think it's perfect for the patients. They need those services in Skid Row. They need that kind of care and love and concern attached to healthcare. But I also think doctors and nurses who are Christian need to have an environment where they can actually practice their faith.
Of his body, O Lord, that you will remove the pain. O God, Heavenly Father, restore his health. Amen. Thank you. Thank you, Dan.
We were happy if we saw 10, 12 patients a day. And hearing those numbers of over 45,000 visits, that's just God.
I can't honestly say I had a vision that 20 years from now this would be a clinic, but I did see there was a need, and I did see that there was a potential for this expanding. We must never forget to just serve what's in front of us and not just think, it's always about the big things. To me, my walk has always been do what's in front of you and do it with a servant's heart.